Ankle arthritis involves degradation of the cartilage at the ankle. This can include other things such as forming cysts in the bone, forming bone spurs around the joint that can limit motion, and then progressive soft tissue contractures and stiffness, as well as inflammation and swelling. Ankle arthritis is most commonly caused by having a prior trauma to your ankle, like a broken ankle or having recurrent ankle sprains. Some patients also have systemic conditions like rheumatoid arthritis that can cause degeneration of the ankle joint. Finally, some patients develop primary arthritis, which has no known cause and is typically seen with older age. Signs and symptoms of ankle arthritis include swelling and progressive pain, especially with bearing weight. Over time, as the arthritis worsens, you may also even develop stiffness and then an angular deformity through the ankle. There are a number of things that you can try at home to help out with your ankle arthritis. I typically recommend trying to ice and elevate your ankle, and you can use ibuprofen or Tylenol as needed for any pain. You can also try an over-the-counter ankle brace to help provide some additional support and compression around the ankle. I also definitely recommend trying to wear supportive shoes as much as possible. If you've tried these things and are still having a substantial amount of pain or dysfunction, then I'd recommend you go see a doctor. There are a number of non-surgical options to help with your ankle arthritis. This can include things like icing and elevating your ankle and trying an ankle brace. These ankle braces could either be a lace-up ankle brace or even a custom ankle brace that's designed specifically for your ankle to help immobilize it. Beyond bracing, we can also try an ankle steroid injection to help temporarily decrease the pain for up to a few months. The two main surgical options for ankle arthritis are an ankle fusion, called an ankle arthrodesis, or an ankle replacement, called a total ankle arthroplasty. An ankle fusion is when we have the leg bone and the foot bone heal together to form a single bone at the ankle. This reliably improves your pain and improves your function afterwards. The main limitations to this is that it reduces your motion and may limit your ability to walk normally. An ankle replacement is when we replace the bone and cartilage at your ankle with metal caps and a plastic liner in between. This reliably improves your pain and also helps preserve or even improve your motion. This can lead to more normal gait and strength as well. The main downside with an ankle replacement is that it may wear out after approximately 10 to 25 years, and so depending on your age, you could require a revision ankle replacement. Recovery after both surgeries are pretty similar. I keep my patients not walking for around 6 weeks after surgery, and then walking in a boot for another 4 to 6 weeks after that. We also begin physical therapy starting at the 6-week postoperative point to work on progressive range of motion and strengthening. Usually around 3 months after surgery, we then are transitioning into an ankle brace and you're progressing your activity beyond there. Usually you're returning to your normal activities by around 4 to 6 months after surgery.